The first thing I wouldn't recommend doing to my face as a facial plastic surgeon is doing excessive fillers. When we look at fillers specifically in the mid-face, if too much of it is placed in the cheeks, it can extend up in the lower lid and create a smaller appearance to the eyes. It creates this pillowy face, so it looks very unnatural and looks like something's been done. The other aspect is when we put too much filler in certain regions, we have to think about what happens when we remove all that filler. The skin can react in a manner that looks more loose, creates more jolly appearance. The second procedure that I probably wouldn't do, any procedure based off of trends. And so trends are exactly what they are. They're trends. They're short-lived. What comes to mind are these excessive lifts on the side of the brow called these fox eye lifts. I think those tend to be outside the aesthetic norms, what I'm comfortable with. It can create an appearance that looks a little bit unnatural. And the third one, getting a procedure from a non-certified or licensed professional. The face is so intricate. The anatomy is so complex. There are nerves that supply sensation to the skin, that give movement to the face. There are muscles that express the face, numerous muscles in the face. So the surgeon has to understand this anatomy to be able to get consistent, safe, and good outcomes. Someone who's not licensed or not certified may not understand this complex anatomy, and treatments could involve devastating outcomes such as nerve injuries, muscle damage, skin damage, things like that. Unfortunately, if these do occur, they can be very hard to fix. And so getting this treated properly the first time by someone who's licensed, like a facial plastic surgeon or a plastic surgeon who performs these procedures on a routine basis, is what I would recommend.